Austin, and I'm a nurse practitioner student. I'll be doing your assessment today.
Okay.
While I'm going throughout her body, I'm going to be assessing her skin for color, temperature, edema, moisture, texture, turgor, scars, lesions, bruising, and needy eyes. When I look at her head is in midline. It's proportioned to her body. When I assess her hair for distribution, which is evenly distributed, I look at her hair for texture, which is kind of porous. Her color is gray. I'm going to palpate your head. You let me know if you feel any tenderness. I'm also palpating for any lesions, masses, depressions, and also checking for any kind of infestations. I'm going to take your glasses off just for a second, and I'm going to palpate the temporal artery. Does this hurt at all?
No.
Okay. I'm going to have you blow your cheeks out for me, or puff your cheeks out for me. Purse your lips. Smile. Frown. Okay. And then I'm also going to touch your face. Close your eyes, and you let me know if you feel it.
Yes. 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 Yes.
Okay. You can open your eyes. And now I'm going to just feel right here. Is this tender at all?
No.
Okay. And can you open your mouth for me? And can you go to the left and to the right with your jaw? Does that hurt at all?
No.
Okay, I'm also checking for her TMJ, which is absent. When I look at her ears are symmetric to her head. They're proportionate in size. I'm going to palpate the trigus and the penny for any kind of tenderness. Does any of this hurt?
No.
Okay, I'm going to inspect the inner canals. Okay, and her ears are clear of any kind of edema or exudate. Then I'm going to whisper something in your ear, and I want you to tell me what I say.
A.
Okay, and again?
A.
Okay. And then I'm going to have you tell me when you don't hear the vibration anymore.
Okay. Now.
Okay, and again?
Now.
One more time.
Now.
Okay, and then I'm also going to have a vibration on your wrist, and tell me when you don't feel it anymore.
Now.
And again?
Now.
And I'm going to also do it on your ankles.
Now. Now.
Then when I'm assessing her eyes, I look at for her eyelashes, her eyebrows, her palpable fissures, which are all normal. I'm looking at her conjunctiva and sclera for color and any kind of lesions, masses, which all are in drainage, which I don't see any. I'm going to use my light and look for accommodation to light. And her eyes are perla bilateral. And I'm going to ask you to put your glasses back on. And I'm going to ask you to read this chart. Can you cover your left eye for me? And can you tell me the lowest line you can read?
D-E-F-P-O-T-E-C.
Okay, can you cover your right eye for me?
D-E-F-T-O-T-E-C.
Okay, and she has 20/20 vision with her corrective lenses or glasses on. And then I'm going to ask you to tell me when you see my finger enter your vision.
Now. 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 No.
Okay, keep your head still, look at my finger, and just follow my finger with your eyes only. Okay, and I would use a red light, but I'm using a red light to look for red eye reflex in both of her eyes bilateral. Okay. Now I'm going to go and look at her nose. Her nose is in the line of her face. It's proportionate. I'm going to look for the patencies of each snare. Which each snare is patent. I'm going to remove your glasses one more time, and I'm going to palpate her maxillary and frontal sinuses. Does any of this hurt?
No.
Okay. I'm going to also assess her lymph nodes, which is her preauricular, her postarcular, her occipital, her tonsillar, her submandibular, her submental, her anterior cervical, her posterior cervical, and her subclavicular. Are any of those sore?
No.
Okay. Now I'm going to put your glasses back on. Now I'm going to assess her mouth. And we're going to look at it at her buccal mucosa, her palates, her pharynx, her tonsils, her uvula tongue, and all that in teeth. Everything in her mouth looks normal. Can you stick your tongue out for me? And her tongue is in midline without fasciculations. Open up for me and say A. Her uvula and her palate move with phonetation. Now I'm going to palpate her trachea. and that seems normal. And now I'm going to palpate her thyroid. Can you swallow for me? Okay. Now I'm going to feel for a carotid pulse and another one on this side. And I'm going to listen for a bruit of the carotids. Okay, and can you move your neck up and back and side to side around? Any problems with that at all?
No.
Okay, and then I'm going to have you just turn to the side so I can listen to your lung sounds. And when I'm looking, I don't see any labored respirations. I don't see any abnormality. Her lungs seem symmetric. And I'm first going to palpate for symmetry, which I feel symmetrical. And then I'm going to have you say 99.
99, 99, 99, 99.
And that was checking for tactile firmness. Now I'm going to percuss her intercostal spaces. And then I'm going to auscultate her lung sounds. Breathe in. Okay. Another deep breath. Okay. Again. 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 Okay. And now I'm going to have you say 99.
99.
Again.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. Can you say E?
E.
Again.
E. 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 E.
Okay. Can you whisper E for me? Again. 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 I was doing her bronchophony, her echophony, and her whisper test. All right, and I'm also going to ask you if this is tender at all.
No.
No CV tenderness noted. Okay. And I'm going to now I'm going to look their normal chest expansion. I don't see any nasal flaring or any kind of labored respirations. I'm going to palpate again for symmetry, which her lung expansion is symmetric. I'm going to palpate for tactile firmness. Can you say 99?
99, 99, 99, 99, 99.
Okay. And I'm going to listen to your breath sounds again. So take a deep breath in. Okay. 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 Now I'm going to listen to her heart sounds with the diaphragm. So aortic, pulmonic, Erb's point, tricuspid, mitral. And I'm going to do it with my bell. The aortic, pulmonic, Erb's, tricuspid, mitral. Now I'm going to listen to her apical pulse for a whole 60 seconds. And assess for PMI. Okay, her pulse was 62 and her rhythm is normal. Now I'm going to have you lay down, but as you lay down, I'm going to look for a JVD at 30 to 45 degrees. And her JVD is absent. I don't see any lifts or heaves. I'm going to palpate for thrills over the aortic, pulmonic, Erb's, mitral, tricuspid, mitral, and I don't feel any thrills. Now I'm going to again auscultate with the diaphragm, aortic, pulmonic, herbs, tricuspid, mitral, and then do it with the bell again, aortic, pulmonic, herbs, tricuspid, mitral, and then I'm going to listen for the bruise in the aorta, in the renal arteries, in the iliac arteries, in the femoral arteries, which are all absent. I'm going to listen to her bowel sounds in all 4 quadrants. When assessing her abdomen, I don't see any abnormalities or any kind of asymmetrical. I'm going to percuss her abdomen for any dullness, tympany, or flatness. And I'm going to palpate for any kind of tenderness. You let me, or masses. Let me know if any of this is tender to you.
No.
Okay, and I'm going to try to assess to palpate her spleen and liver. Can you take a deep breath in for me? Okay. You let it out. Okay, and you can sit up for me. And I'm going to do a light and a test on your, I want you to tell me if it's sharp or dull, okay? Close your eyes. And is it?
Soft.
Okay.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. 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 Sharp.
All right. And I'm going to have you keep your eyes closed. And I'm going to put an object in your hand and I want you to tell me what it is.
It's a round coin.
Okay. And in this hand?
It's a key.
Okay. And I'm going to write a number in your hand and I want you to tell me what it is.
9. 9.
Okay. And you open your eyes. And I want you to do your hands back and forth for me. Okay. And I want you to do your fingers for me. And can you put your fingers together? Okay. I'm going to assess her fingers for capillary refills, which are less than 3 seconds. I'm looking at her fingers and I don't see any abnormalities, lesions, or nodules or edema. Can you flex your fingers for me, move them around? Any problems with that?
No.
Okay. I'm going to feel her radial pulses, which are both present and normal. And I'm going to look for any abnormalities, masses, or lesions on her wrist and edema. I don't see any. Her hands are warm. Can you move your wrist around? Okay. Can you put your hands up? Can you push against me? Can you pull against me? Any problems there?
No.
I'm going to look at her elbows, which don't appear to have any abnormalities as well. No lesions, no nodules, no temperature is normal. Skin looks normal, no edema. And can you go out and in with your elbows? Any problems there?
Nope.
Okay. And when I look at her shoulders, this right shoulder has a scar on it from surgery, and the left shoulder is normal. Can you push against me with this? Can you pull against me? Okay. And can you move your elbows around? Okay. I'm going to check your deep tendon reflexes. So I'm going to have you put your hand over. Okay. 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 While I am assessing her toes, I'm tracking capillary refills, which are normal. I don't see any abnormalities of her toes, masses, lesions. Her toes are warm. Can you move your toes up and down? Okay. And as I'm looking at her ankles, I don't also see any abnormalities. Can you wiggle your ankles all around? Okay. I'm going to feel for the dorsalis pedis and posterior tibial pulses. Both are present and normal. Can you push against me with your feet? Okay. Can you pull against me with your feet? Okay. When I look at her kneecaps, they also look normal. No abnormalities, no masses, no lesions. They feel warm, no edema. Can you pull your feet out towards me? Okay. No problems there?
No.
No. When I assess her hips, they feel normal. And what I can tell, there's no abnormalities. Can you push against me with your hips? Can you pull against me with your hips? Okay, and can you stand for me? Okay, and can you go out and in with your legs? Any problems with that?
No.
Can you move around with your hips? No problems with that? I'm again feeling for symmetry of her hips, which her hips are symmetrical. Can you turn around for me? Okay, can you bend over? And I'm assessing her backbone for any kind of scoliosis, which is not noted. And her hips do look symmetrical. Okay, you can stand up for me. Can you put your hands by your side, and can you close your eyes? Okay. Can you hop on one foot? Okay. Can you hop on the other foot? Okay. Can you walk down and back for me?